a person sneezes or coughs. And that, in turn, produces an aerosol effect. In other words, droplets, moisture from our lungs, from our nose, from our respiratory passages goes into the air in the form of an aerosol, just like if we were pressing the button on an aerosol can. And that's what happens. You can't very well see it, but against this background, this black background, this is in effect what happens when someone sneezes. One cough and the entire world changed. Today I'm going to cover the bad, the useful, and the good. And no, I am not Clint Eastwood, but it does remind me of his movie. Let's start with the bad. Here are some of the bad news. Look first at this graph. And these are confirmed cases per million inhabitants in several countries that you see listed here. Italy being the one in front of the pack. And look how steep that curve is. Very steep, and still hasn't reached a plateau, nor has it started to come down. And this graph is the same thing, but in using an exponential curve. Total number of deaths in Italy, and I'm choosing Italy because it's a country of interest. It's ahead of us, and it kind of tells us what we might expect for ourselves here in the USA. And this is a graph of the total number of deaths starting around mid-February up till a couple of days ago. And as you see, the curve continues to rise, continues to rise. Here are the numbers. This is perhaps a little bit confusing, but if you look at Italy, this is their population, 60 million. The total number who have been diagnosed, DX, diagnosed in 1 week. This graph covers one week, 3/19 to 3/26, okay? That number has doubled. The number of deaths, the total number of people who have died has more than doubled. And the number of people who die every day has oscillated between 650 and close to 800. It has not plateaued. It's still going up. Spain, another country of interest to me because my family's roots are there. Population 46 million. I mention the population so that you can compare to US. We have 325 million. Total number diagnosed has doubled since the beginning. Total number who have died has more than doubled in just 5 days, 6 days. Now let's go to our USA figures. Total number diagnosed is about 5 to 6 times from 319. Now part of this is an artifact because it's caused by increased testing. So at first we were not testing too many people, and now we're increasingly testing more and more each day. On the other hand, the number who die, this is an accurate number, it's not affected by testing. These are people who die from the disease. It's gone from 217 to 1,200. So 6 times in just 1 week. Now I'm going to show you 3 slides of what we need to do. We need to intervene to bring down these curves, the curve of the infected, that is the diagnosed, the curve that shows the people hospitalized, and the curve that shows the people who die from the disease. And this curve represents the number that we have to provide beds for. So how many beds do we have versus how many people need to be hospitalized? This graph is a modeling of no intervention, or intervention for only 1 day, which is nothing, Okay, intervention meaning social distancing, staying at home, washing your hands, the usual precautions, okay? Now, if you do effective intervention for 28 days, look how that curve changes, okay? It flattens. This is the flattening that's being talked so much about on TV, and that's with just 28 days. We are not there. We barely have 14 days of imperfect uh, intervention because people are still going to the beaches and doing crazy things. I think we're going to have to do 56 days because we have not been good at doing those initial interventions. People are not staying home. People are continuing to get the disease. And until we flatten the curve this way, we're going to be in trouble. Do we have to take this seriously? As I've always said, yes, very seriously. And so far, we're not. Right here in the Del Mar area in San Diego, every day we still see large numbers of people going to the beach. It's crazy. Okay, let's turn a little bit more positive. What is useful? What are the practical things? First of all, we need to learn about the viability of the virus. I spoke about this the first time around, but let me summarize it. Aerosol droplets are undetectable 6 hours. After that, the virus is dead. It falls to the ground, it dies. That's the good news. The bad news, it's still around for 6 hours. Now that varies with climatic conditions, temperature, humidity, wind, and convection currents. And convection currents is something important that I will come back to in a minute. And again, just to repeat the information, COVID-19 remains in plastic and becomes undetectable at 72 hours. On stainless steel, after 48 hours. On cardboard, after 24 hours. On copper, after 4 hours. So plastic is where it remains the most in a viable state, but after about plus or minus 72 hours, it's gone. It's undetectable. It's probably not viable. Now, you have seen a report which is very misleading that says on cruise ships it lasted for 17 days. That is incorrect. There's no data behind that. It was a personal communication between scientists, and there is no data provided, and it's probably incorrect. My feeling is that they were detecting virus that was not viable. They were just detecting the uncoded RNA. Now, one of the things that you can do is establish a sanitizing zone at home. We are all quarantined, or we should be. So we are all staying at home and enjoying the quarantine. And one of the useful things is to establish a sanitizing zone. Now, what is that? Let's say that this is your home and you have a main entrance and you have a secondary entrance through the garage. Where do deliveries come? Where do people come to visit? Well, usually they come in here. Well, my suggestion is that you put a sign on this door and say, please use back entrance or garage entrance. Why? Because this door leads right into your living quarters, your sleeping quarters, your dining room, and you don't want anyone coming in here and infecting all of that. So what you do is you have them come in here, delivery people, and even family, okay? And you have this door closed. Let them knock, let them ring. And then when they do, let's say it's the pizza delivery. A lot of us are having more pizza than we need. Then you say, okay, stop right there. Have them stop at a distance from that door. And have them put the pizza in its carton on the floor. You have already left a tip, perhaps under the rug here, on the piece of carpet or something. Have them pick that up, turn around, and leave. In the meantime, you are staying a distance away. Then you come pick up that pizza. You put it here on a shelf. You take the pizza out of the carton and immediately you put that cardboard box into a trash can. Take that pizza, put it in the microwave, and warm it up. Don't scorch it, it won't taste good. That way you avoid any virus that may have been on the cardboard box. Now, if what they're delivering is groceries, then you put all of the groceries here, and the ones that need refrigeration, you swab them, you clean them, you sanitize them with hand sanitizer, with alcohol, with a bleach solution before you put them in the refrigerator. Because you have to make sure they're free of virus, and virus stays for a long time on plastic, remember? And if you put virus into the refrigerator, you're just preserving it. Then when you take it out and touch that plastic and take your hands and touch your mouth, you'll be contaminated. Okay, so this is sort of like a safe area, a sanitizing area, and you try to keep that as virus-free as possible, and whatever you bring on there, you sanitize and kill the viruses. Now, there may be some things that are canned foods. Well, instead of wasting a lot of time and sanitizing products, you just leave those canned foods there overnight, or preferably over 2 nights. And during that time, the virus will not be viable anymore. And then you can take them from there and stash them in your kitchen cupboards or whatever. Now, preferably that sanitizing area will be close to a washroom, where as soon as you get out of there, you either sanitize yourself, your hands, or you go to the washroom and you wash your hands right away. Soap and water, very effective, even more effective than hand sanitizer. Now, convection currents. When you open that door, if that person is infected, even though that person is standing outside of the door, you are creating convection currents within that room, okay? Where warm air, because of your heating system, radiators or whatever you have, rises and meets the cold air coming into the door and falls, rises and falls, and creates currents within the room. And it could bring virus in from that person. So that's why social distancing is important. That's why you have to keep everyone away from your door. You can open the door, you can be sociable, but at a distance, because you have to be considering that convection currents will occur. Other things that you are going to do in that safe, in that sanitizing zone. Wear gloves. When they hand you that pizza, take it with a gloved hand until you discard that cardboard box. Use your gloves. And then you have to discard your gloves or really sanitize them before you use them again. Masks. Do you have to wear masks all the time? No, you don't. But I personally, when I go out to the post office, to the pharmacy, or to the supermarket, I wear this kind of a mask because it's the one that most of us have, right? And it's not perfect. It doesn't help 100%, may not help even 50%, but it's something, and it's all we have. And you know what? I put that mask on, people stay away from me. And if in spite of my wearing the mask, someone comes close, I cough. I fake a cough. And immediately they clear a space around me. It's very effective. Now, here is the good mask. You see the number N95? It means that it filters 95% of particulate matter. It does that if it fits well and if you have it tightly against your face and nose. If there's a space, if you wear it loosely, air and viruses could get in there. Now, is N95 a brand name of 3M? No. N95 is a certification provided to 3M and to any other brand of mask that meets the 95% clearing of particulate matter requirements. It's a certification granted by the federal government who studies the masks, and if they meet the requirements, they allow them to use the N95 letters and number on the mask. It's a certificate granted by the National Institute for Occupational Health and Safety, NIOSH. Use a sanitizer, keep your distance and have others keep their distance. And then there's some practical things that you can do. I have been using a Honeywell 5250 air purifier for over 5 years or so because of allergies. So I've had it in my room. I turn it on during the day. I turn it off at night because it makes too much noise. But it's very effective. It has an activated carbon filter and a HEPA filter. It filters air in about 400 square feet area 5 times per hour. You can use this in your room like I've been using it for allergy. Or you can put it in that safe sanitizing area and filter out any viruses that might come into the air. It doesn't have to be Honeywell. I don't have stock in Honeywell. It can be any other brand. There are many good air purifiers as long as they are HEPA filters. Okay, they can filter particles as small as 0.005 micron. That will take care of the viruses. Okay, and the other thing you can do is use a humidifier. It doesn't help much, but again, every little bit helps. I've also been using it for allergies to keep my bedroom properly humidified and not let it get very dry. So these are 2 items that some of you might already have. I'm not saying go out and purchase this, it's indispensable, it isn't. But if you have them, use them. And you might consider using them not only in your bedroom, but also in that safe sanitizing area or sanitizing zone if you do decide to set that up. Just a suggestion. Prevention. Follow all precautionary measures. Stay at home as much as possible. Please don't take any medications or supplements other than your daily medications prescribed by your doctor. We all have a lot of anxiety. We're all hoping, any glimmer of hope, we go after it. Zinc, NyQuil, multivitamins, all sorts of supplements. People are taking everything. The pharmacies, the shelves are empty because everyone has taken all kinds of vitamins, multivitamin supplements, etc. Don't you know that some of those counteract each other? Don't you know that some of those counteract medicines that you may be taking for blood pressure or for something really necessary? And some of them even work together to produce serious adverse events. Be safe. Don't take anything unless your doctor has prescribed it. Okay? I know most of you will not do that, but I have to mention it. Okay, let's go to the good. I am
and sorry, this is Kim. I just interrupt and say we'll probably need to start our speaker in about 4 or 5 minutes, just as an alert as to where we are in the timing.
Thank you. I'm getting to the end. The good. I want to finish on a high note because it's pertinent. All of our pharmaceutical companies, all of our biomedical companies, and there's 400 in the San Diego area alone, are working on the vaccine or antiviral medications or all sorts of medications to treat the virus or its consequences. And I am confident, knowing and having been part of that community for many years, that many good things are being developed. It's just a question of time. We are going to take care of this virus. We've done it before for many other viruses. We are going to do this. It's just an issue of time, and we have to do our part. Take your precautions because this is going to take a little bit of time. We have to be patient. Remember those curves, 1 day, 28 days, 56 days gone, okay? A lot of things being developed. Most of these are in clinical trials. Be informed, not scared. Follow the recommendations of the health authorities. Apply your common sense, be prudent, stay healthy. We will survive. This too will pass. Thank you.